Hello, my name is Tyson DeKunik, and I am the Marketing and Events Manager for the Eden Foundation and Eden Healthcare Services. Today, we sit down with Greg Hiebert, a valued member of our team at the Eden Mental Health Center and a former patient who shares a powerful story of how his life has come full circle. Greg was courageous enough to volunteer to share his story so it may inspire others with hope, give the community a glimpse into his experience with Eden, and help break down some of the stigma that surrounds mental health. He was provided with a list of questions and an outline of topics in advance, but all responses are his own and reflect his personal experiences and perspectives. Please note that neither Greg nor I are mental health professionals. The perspectives shared are based on personal experience. We invite you to listen with open hearts as Greg shares his story. So we're here today with Greg Hiebert. Greg Hiebert is currently one of our maintenance guys at Eden Mental Health Center, as well as Ensports, one of our supportive housing units in Winkler. Greg, how long have you been with the Eden organization?
3 years.
Three
In
years.
August.
3 years in August. Okay. And you like your job?
Yes.
Yeah?
Yeah.
So I was talking to Greg the other day, and he was redoing a bunch of flooring in one of the units in Ends Courts, which I thought was pretty impressive because, well, when I've tried to do flooring, it hasn't worked out super well. And I think that's somewhat outside of your job description to redo an entire, flooring, paint all the walls, that sort of thing. So I just thought it was really, really cool that Greg was going above and beyond to, make sure that people are living in a decent place in our supportive housing units. So thank you for being with us today, Greg. Um, would you mind introducing yourself and telling us a little bit more about your day to day at Eden?
Yes, so I'm Greg Hiebert. I work half time at Eden Mental Health Center and the other half at Eden at the Ends Court, or it's for Eden Healthcare Services. Uh, Typically, I make sure the walks are clear of snow. Summer, lawn is mowed, trees are trimmed. Um, we're starting want to do a little bit more gardening and that kind of thing.
Yeah. And so what's your most enjoyable piece of your job? Is it the hedge trimming? Do you like kind of just mowing the lawn, listening to some music, or like what is the piece you look forward to in your job?
I like interacting with people is one of the biggest highlights. Um, and yeah, like making life better for people.
Right. Awesome. And so you have a longer history than just working with Eden,
Right.
right? Could you tell us a little bit about that?
So when I was 18, I started having delusional thinking. My mind started racing. I started getting um, my thought process started getting way out of control, and I ended up being institutionalized here at Eden, and I stayed there for some time.
Right. And so that was how many years ago?
So that was when I was 18, so yeah, I'm 43 now, so do the math.
Yeah. 25 years ago, right?
Yeah.
Unless I did that math wrong. Sorry, everybody. So 25 years ago, you had gone to the Eden Mental Health Center, and now you're working there today, which I just think is a really cool story that it's come full circle for you. And like I said, when I ran into Greg the other day, he was redoing a bunch of flooring in one of our supportive housing units, and I just thought it was so cool that he's adding so much value to the community and so much value to the Eden organization. And I feel like in a way, it's kind of giving back for the positive experience that you had at the Eden Mental Health Center, right?
Yep.
Yeah. And so, what did life look like before you went to the Eden Mental Health Center? And like, what was the treatment process like?
So I would say grew up had a fairly normal life, although I had a lot of maybe some mental anguish, um, a lot of anxiety maybe, but in general, I was projected in my mind. I felt like I had a good future in front of me. I had interact with my friends normally, and I had a job. And then when I came to Eden, so the first few weeks were quite high, and then I hit a low, and then it looked like life was taken from me, and there was no hope for the future. And so then that it took me a long time to find my feet again after that.
Mm-hmm. And so how long were you at the mental health center?
So my first time was 6 months from the time I walked in the doors till the time I was discharged.
Right. Okay. 6 months.
Yeah.
Okay. Gotcha. And after 6 months, I believe you went into the employment services. Is that correct?
I tried out a few things. Back then there was a Train X. That wasn't quite what I visioned for myself. So um, there was different people that kind of took me on or kind of helped. I just slowly graduated back into the workforce, although it was with a lot of effort.
Right. Okay. And sorry, I kind of jumped ahead a bit here, but going back to the Eden Mental Health Center, your first days there, what was the experience like? Like you had like your own room, or did you share a room, or how did that work?
So back then they shared rooms.
Okay.
I shared a room with an older gentleman. He was very kind, and so I was 18, I was young, so it was kind of a scary place to me. But then the nurses, they were very accommodating. They would help me when they would help me in different areas. I know one time we even went out for ice cream, and a lot of that has changed now with different circumstances. But we also had a workshop downstairs. We'd go down there and we'd do woodworking, and we'd also go bowling every week with a bunch of people, and yeah, it was different. It was they had a pool table, so we could play pool if we wanted to. We could play, um, and then what was interesting is some of the staff on their dinner breaks would come and play pool with us.
And so when you were at the health center, what gave you hope during this time for the future? I know you talked about a high and then a low and then coming back to hope for the future. Where did that start from? What do you think led to you finding hope for your future?
Well, I find that I dealt with, or there was different people that helped me. A psychologist helped me with my thinking process. Um, and yeah, there was a lot of encouragement I experienced there. I had, um, yeah, just different. I know one nurse told me that when he would see my smile again, then I would know that I was ready to go home. So that kind of tells you a little bit how it was when he said I could actually hear you laugh, I think is what he said. So it was quite a low time when I couldn't do anything like that. So.
Mm-hmm. And so it sounds like this nurse was like kind of inspirational, or
Oh
he
yeah, it
was,
was
yeah,
very, very one-on-one. Yeah,
right.
lots of walks we took together. Lots of walks,
Mm-hmm.
and yeah, a lot of encouragement. And yeah.
Yeah, awesome. And with the psychologist, I know when we had chatted earlier, you had talked about cognitive behavioral therapy was a part of your program or speaking with the psychologist. Do you mind telling us a little bit about that or how it worked or what that meant to you?
So it changed you work with your thought processes. There's different ones now that are more advanced. Dialectical behavior therapy is one, but this is kind of the same thing. It analyzes your thought process and breaks it down, and then um, you maybe repeat certain things to yourself. Positive self-talk is huge when it comes to when you get up during the day and you have a negative emotion. You learn to dissect that emotion and how to react.
Okay, so there was some good
Yes,
learning experiences with the psychologist. And so was that, I may be getting these names wrong, but was that Dr. Dick or was he a psychiatrist?
he was a psychiatrist, Dr. Siegfried Hebert. He is retired now,
Okay,
and Dr. Dick was also my psychiatrist. He helped also very much with uh, a lot of um, visits, positive feedback. Also, when you don't know, when life throws you a bunch of different curveballs, it's always nice to talk to a professional once a month, or sometimes it can be spaced out every 3 months, or sometimes I think it's been even up to 6 months, but it always is kind of according to the need. And that's been very helpful.
right. So it sounds like you had a good mix of talking to psychologists, coming up with, sustainable ways to change your thinking, as well as meeting with a psychiatrist to see if there were any medications that could
Yes.
potentially help get you on your way.
And then also with that, then the psychiatrist has also throughout the years helped me very much with medications. Sometimes we change things up a bit as time goes on, time progresses. Um, Maybe I don't need as much medicine in one area. Maybe I know as later on we help with my ADHD was kind of diagnosed, and that helped me tremendously to do that. So then we always are kind of tweaking medicines a bit, and it works.
Right. Awesome. Yeah, it sounds like a good hybridized system. Like
Yeah.
some people may think that when they go to, a mental hospital, that they're going to be pushed medication, but it sounds like from your experience, there was a good hybridized system of getting you back on track.
Yes.
Right. Okay, we're going to take a short break here and we'll see you back in just a minute. What you're hearing in Greg's story is something we see every day at Eden. People come to us in some of the most difficult moments of their lives looking for stability, support, and hope. Through services like counseling, psychiatric care, and supportive housing, we walk alongside individuals as they begin to rebuild. And sometimes, like Greg, those who once needed support return to help others. That's the kind of impact Eden is working toward every day. But this work doesn't happen on its own. There are important needs that fall outside of standard funding. Things like making care accessible through our sliding fee scales, maintaining and improving our facilities, modernizing systems, and supporting new and innovative programs to help those in need. It also includes everyday but essential needs like equipment, repairs, and creating safe, comfortable spaces for those we serve. Your support helps turn moments of crisis into opportunities for healing and a new beginning. Okay, we're back here with Greg Hiebert, former patient with the Eden Mental Health Center and now one of our valued staff at the Eden Mental Health Center. And so, Greg, you had been to the Eden Mental Health Center as a patient on a couple of different occasions, right?
Yeah.
Could you tell us a little bit, maybe the second time, why you had come back to the Eden Mental Health Center after being admitted?
So the second time I was um, not managing life properly. I got um, not taking our medications properly, and got to do some stressful situations, and all of a sudden, boom, I was back. And so third time was more kind of the same idea, like stress and not taking your medications properly, and not you're letting your life go out of control, maybe not sleeping properly, and those things will cause a relapse. And then another time I tried to go off of my medications and take something more natural, and it didn't work for me. And those were, there was, first time was a high, and then a couple times later I went in on a low. And so it's been kind of up and down for probably the first 10 years after I was hospitalized. And after that, it's stabilized more.
Right. And so the last time you were there was about a decade ago, is that right?
Yeah.
Yeah. Awesome. So that's a long time that you since the last time
Yes.
you've kind of sounds like you've learned from those experiences
Yes.
though, right?
Yes.
Going off of your medication on I'm assuming your own accord, right?
Yes.
Yeah. And now working with, a psychiatrist or psychologist continuously today?
Yes.
Yeah. Okay. To make sure you continue to stay on track. And so you have you got a family, you're married,
Yeah.
you got a kid,
I have two children and one on the way.
one on the way.
Yeah.
Okay. You got boy and a girl, or
Boy and girl, and we'll see about that one. Yeah.
that's a dream. That's what everybody wants. They want one
Yeah.
boy, one girl,
So,
So many people, they'll have three boys and then they're like, I'm not going for a fourth because they
yeah.
want one of each,
Yeah.
So
Yeah.
lucky man.
So,
So when it comes to you return to the Eden Mental Health Center and that sort of thing, was it a similar process of getting you back on track, or did things change when it was your second or third time being admitted?
most things kind of were the same. We have made some adjustments. Um, I also since then, which is interesting, um, one last time that I went in was when our twins are born. One died, and I that was a real stressful time. And then the next after that, I haven't, but we've had crises since. My wife was in the ICU for about 2 weeks during COVID, and that was a whole new set of problems. And we also had a baby boy that had a rare condition that we had to fly to Toronto, and in the end, it wasn't successful, and he died. And so, yeah, it's about managing stress, um, and also I would want to say here is that my faith has been a very integral part of it, and I give God a lot the glory for that. But it also um, that with that it is very important your lifestyle and your um, lifestyle work balance, that kind of thing.
Right. I think your story specifically gives people a really good glimpse of, you know, things that anyone can understand of why your mental health may take a downturn, like the loss of a child or two children,
Yeah.
even like that's. I think anyone watching this knows that would be incredibly painful
Yeah.
and could cause for some. That's the worst type of stress that I could imagine, to be
Yeah.
honest, right? So, um, just the fact that you found your way back and the mental health center was able to help you get back on track after situations like that is amazing. And
Yeah.
you're doing so well now, having been out for 10 years, working with the Eden Mental Health Center now, and killing it. Every time I go over there, Greg's doing something. But I wanted to go back a little bit to talk about TrainX, because TrainX has been integrated into Segway Career Options, the employment services for Eden now. And so, what was the experience with TrainX like? I know you said it wasn't quite for you, but what did you do as a part of TrainX?
So it was basically they did like um, they I only worked there for one day actually.
Okay.
But they had machinery, they did different things. They had, and I kind of forget. I think what the biggest thing that helped me get back on my feet as far as work goes was how they paired me with a psychologist and helped me work through different things at work. Like, I had extremely OCD, like mental illness. You can't really target with one set of, uh, one diagnosis. Like your brain kind of goes, it misfires in all directions. And so I had a lot of OCD, and working with tools, working with wires, working with, maybe I would be cutting into a wall, and then what if there'd be a wire, and I'd lay awake at night because what if I had cut into a wire and then place would burn down and I'd lose my job. And so the psychologist worked one on one with me and was constantly trying to work with my thought processes.
Mm-hmm. So yeah, certain jobs like that would
Yeah.
cause you like kind of excruciating anxiety
Yeah.
for something that should be
Yeah.
small or normal.
And I didn't want to say it with anybody because people would think I was weird, like I was psycho.
Mm-hmm.
So
Yeah, I mean, there's a lot of stigma around mental health, right? Have you experienced that stigma? Has there been a good experience with the Eden Mental Health or the Eden organization for kind of reducing stigma? Or
yes, there's been. It seems like sometimes there's a lot more awareness today. Sometimes I've been faced with, well, you can't do that because you have, this is a feeling you get. You can't do this because you've got this label on you, and it helps to know that people you can do it. They can help you with where you want to go.
well, I think that's what we're doing here today is we're trying to reduce mental health stigma through you sharing your story with our audience. Like some of these things you've talked about, some of these hardships you've been through are very understandable. And so instead of folks thinking that, certain people who go to the mental health center are off kilter or whatever, it's like there are some hardships that people go through that can cause them to their mental illness to arise or like come back potentially if they have managed it successfully in the past. And like some of these people that we're trying to help, they've just gone under hard times. And the Eden organization is here in many facets, whether it's the employment services, our counseling, our supportive housing, or the Eden Mental Health Center, to bring people back to a state where they can have hope for the future and live a positive lifestyle, essentially. So you sharing your story is it hopefully will have a huge impact on mental health stigma. And so now we're at the full circle part, I would say. And so obviously if you've decided to work for Eden in the maintenance department, you had a certain amount of admiration or love for the organization. You decided to come back in a working role. And as I think we've talked about in this interview so far, I've continuously seen you go above and beyond the call of duty because you believe in what we're doing here with Eden. And so when that Eden job posting came up, or maybe it was through your network or whatever, how did you feel about applying to work at the Eden Mental Health Center? What did it mean to you to come back to the organization in a working role?
Well, I feel like I have a lifelong debt to Eden. Um, there was times when people did that to me. They went over and beyond the call of duty. Um, there was people that spent. I think of the different people out there that I remember. The one head nurse, she came in. I was 18, like I say, I was barely met the threshold for being at Eden, and they were like mothers to me. And I always have thought of being somehow, could I somehow in a way give back to what I experienced. And so I am going maybe from past a lot of things kind of motivate me from things that people did from the past. And then I also want to embrace their vision, what they had in mind for people, for humanity, because a lot of, I think they had, some of them aren't here anymore. Um, but I think they had a vision for humanity that I would like to embrace. Um, and that doing goodwill and helping people um, can make and make a difference in people's lives. So I mean, you may never see the outcome of what you do today.
Mm-hmm. And the Eden Mental Health Center has been around since 1967, I believe, is when it officially opened. And so, folks like Greg, I mean, there's countless stories out there of people's lives who
That's right.
have been changed, right? So, I mean, Greg is just one of those examples. And the work that Greg does today supports that continued rehabilitation of folks who are dealing with mental illness or struggles with their mental illness, right? How do you think it affects you in your work today, knowing that some of the patients that you may encounter on a daily basis, right, is that you understand their circumstances um, potentially like nobody else, right? Like you understand what it's like to be in their situations, and you have hope for the future. And you said you got a kid on the way, and so the great things coming, right? And so you know that there's a future for them, the current patients, when they may not see it yet as they continue to go through their treatment program. So how do you think it impacts your role and the role that you play at the Eden Mental Health Center?
Well, I think it is, and I think there's a lot of staff that have that same thing. They've maybe gone through circumstances and they want to help out, um, and they can identify with people that are going through rough times in some form or another. It's I'm just a sample of many others that are out there that are the reason why they do things maybe sometimes beyond what their job description is because they've been there and they know what it's like.
Mm-hmm. Right. I would see it as inspirational. That's kind of another goal from this interview is so that folks in the Eden organization know who you are, know that you have taken part in the Eden organization in multiple roles at this point. And so if patients know you and they see you doing your work at the mental health center, they can have inspiration for the future of they could potentially end up in a situation where you are with a loving family, steady job, and hope for the future.
Yeah, and I really appreciate Eden. They help. I've told many people before, regardless of your religious affiliation, they want to point you in the direction where you want to go as far as making a better person or to a better place.
Mm-hmm. And you said your faith has had a big impact on your
That's
mental
right.
health
Yeah.
journey, right?
Yeah.
Do you mind sharing a little bit on how that has affected you? And when did you find your faith as well? Were you religious as a kid, or did you find it more in your adulthood? Or can you talk?
Well, I think it's been a journey. I really do. I think I accepted Christ when I was young, but then I think I fully found a more deeper meaning when I was probably 20-ish or so. And the thing is, spirituality is and mental illness is a bit of a complex thing because there are some days you feel numb and there can be weeks where you feel numb and you're going on faith, but it is I feel like it's very important that we keep those things. For myself, it's important that we give God the due honor and and also, it's a lot. It's a faith thing because medication and can dull a lot of feelings, and it might not feel like you're very courageous some days, but you have to keep the view and not the end goal in mind.
Mm-hmm. What would you say to someone who is struggling with their mental health today? As someone who has gone through years of, sorting out their mental health situation to a point where you have been, on track for the last 10 years, what would you say to someone who's maybe in that beginning journey, say where you were when you were 18 years old?
Well, it's a journey, and you have to stick with it. The good thing is that medicine is always improving, and there are things that when I started out with, I started out with in '01. There are different studies and different things that are always improving, and so it's things have improved a lot. Awareness has improved a lot. Mental health awareness has improved a lot. Um, I would say that there are way more tools available than there was. It's going to keep on doing that. I feel like it.
Mm-hmm. Technological
Yeah,
advancements, potentially medication
yeah,
advancements. Um, yeah, more resources come available. We learn more
yeah.
about certain conditions. And so, if somebody wanted to get help potentially for their mental health struggles, where would you send them first? What's the first advice you'd give to someone who's dealing with, let's say, anxiety or depression?
Well, I would get in contact with your local mental health provider, but also it's been the way I see it is talk to your doctor first, and then he can refer you. Um, Most people have their own doctor nowadays, and they can get them to refer you on and then give you the resources.
And is that how you first came to the mental health centers,
Yeah.
through your doctor? Yeah, through your family doctors. So you just
Well, I had a doctor. I no, I had visited the doctor, but then actually I came to Boundary. Well, I actually went to Altona to the emergency there. So if things get out of control, go to the emergency
for the emergency. Okay,
or call your local EMS service or your police or whatever.
right. So in moderate circumstances, talk to your family doctor, get a referral, see how they can help
Yeah,
you. Extreme circumstances, head to your local emergency room.
emergency or call 911.
Right.
Another thing is the police service. I find is many people are hesitant to call police because they are scared they're going to get a criminal record. If it's under the mental health, if you're experiencing mental health issues, it's not going to be it's under many people they have a different uh, take on that, and the police is there to help you. If you're
Mm-hmm.
feeling at all at risk of harming somebody or harming somebody else, it it's there to help you, not to, they're not going to do damage.
Right. And from what I understand, like police these days, that's a pretty big focus in their training and in the
Yeah,
academy is helping with mental health
yeah.
situations. Yeah. So, if we could go on to potentially a message from the community, from yourself, why are organizations like Eden so important for people who are struggling? Like, there's employment services, supportive housing. I know you didn't go to supportive housing, but you worked with it, right? Like, what do you see in the supporting housing units you've been in, and how that impacts people with mental illness, and how that potentially gets them back on track, just from your observations?
So I would see that judging by or having experience supportive housing is maybe it's not even that much support, but they create an environment where you, as somebody suffering from mental illness, they maybe know how to react to some of your situations, and they know how to. It's more of a healing environment than um, the regular place.
So instead of just being alone in your apartment, your house, or something like that, there are staff that you can call in, rely on with
Yeah.
different programming as well, right? At the supportive housing units.
Yes, there's also different programs that can help help you maybe get out, and do something, or um, let's go and be with music therapy or that kind of thing.
Right. And so, what do you think? How does community support play a role in someone's recovery? And
So I did discuss. I did at one point. I did have a visit with a mental health worker. Uh, every every month, but it helps to get integrated into back into society, because when you have been at a facility or even institutionalized, it takes a long time to get your feet under you again.
Mhm. And I know a lot of our supportive housing units, there's a focus on socializing with other residents as well, right? And just getting as much social aspect as you can.
Mm-hmm.
Like I know at Linden Place, they make supper, I think daily. One of the residents will make supper for the
Right.
entire household, right? So that brings people together. At we have different tiers of supportive housing. So we have tier 1 to 5, one being the least amount of support and like the least amount of accommodations, 5 being social workers 24/7, that sort of thing. So we have different tiers that you can be in some of our lower tier programs. We have like something as simple as coffee in the morning, right, or tea in the morning with some cookies. Try and get the residents downstairs socializing with each other and making sure that socializing has a big effect on mental health, right?
Absolutely. Yeah.
Like staying tucked inside your room
Yeah.
is not super healthy.
Even a little bit. Like, you don't need much, but you need a little bit because it helps you get out.
Right. And even just with my own mental health struggles, just like, when I was in university, right? It's like when COVID came, for sure, university was closed down, no extracurriculars, and you just got to study from home. You're kind of like in your apartment, maybe you got a roommate, that sort of thing. But then you realize that after that time, that the socializing of going to class, going to school, being in the extracurriculars had like a huge impact personally on my mental health.
Yeah.
And so I couldn't imagine for someone who had been institutionalized and is coming back, how much of an effect that socialization would have on them in a positive way.
Yeah.
Many people in our community support the Eden Foundation, which is our fundraising arm that supports all of the different programs within Eden. Many of the people in the community support them with donations. Um, what is one thing that you would want them to know?
Yeah, huge, because uh, it's like, so the center, we have uh, funding for a lot of things, but there's a lot of places that we fall short of funding. And also at the housing support is the same way. It helps us um, make life better, make like, let's say, build stuff in the yard, um, uh, keep our institutions running, keep um, funding for uh, things that help our residents, um, support them. Yeah.
Yeah, a lot of things that are outside of the standard funding that
Yeah.
we receive
Yeah.
through Southern Health
Yeah.
and supporting the nurses, the doctors, paying the wages, right? Like things like you guys need a new tractor at the mental health center,
That's right. Yeah.
And so like that is something that we're fundraising this year to cover. And tractors aren't cheap, right?
No. And like painting a fence, the fence outside, or yeah, just general upkeep.
Right. And then, like, there are, of course, other programs that the Eden Foundation supports. One of the big ones is Recovery of Hope Counseling. We have a sliding pay scale. So when people come to us and they want to see a counselor, they want help with their mental health, they can see a counselor at a significantly reduced rate if depending on what their income is. So therefore, anyone who wants help but can't quite afford it should be able to see a counselor, and the donations made from the foundation to Recovery of help support that pay scale. So yeah, anyone who wants to see a counselor, we make sure that they get the help that they need. And then, of course, our employment services are supported by the Eden Foundation. Our employment services, I know you went through TrainX, so they've changed a little bit since then. It was amalgamated into Segue Career Options, which is the modern employment services of Eden Healthcare. But often it's for residents who may have been in supportive housing, who have come out of the mental health center, as well as people in the community who are just in need, who are trying to find a work placement. We can train them on basic skills like how to make their resumes. We can do mock interviews. We can get them set up with like a modern Microsoft Office suite and ensure that they're ready to join the workforce with confidence, essentially, is a big part of it. And one of my favorite things about that program is the work placements. So we have partnerships with different businesses in the community, so we can get those people volunteering in a role temporarily, and often those organizations will then hire them after that role. That's not always the case, but regardless, it's really good work experience for those folks. And so the Eden Foundation supports the work of the employment services to ensure that continues to go on. Last thing here, Greg, when you think about the person you were before coming to Eden, to the mental health center, and the person that you are today, what do you notice?
Like my overall, like from when I started at Eden, or when I was a patient at Eden, or
Patient. So when you were
tell
18
here.
to today.
Well, I think, in a way, I think I was very deeply disappointed in my life, the way it went. When I first, it wasn't, I was supposed to be a different person, I think. This is what I let's say where my life was headed was supposed to be in a different direction. And then I got hit with this mental illness. And in spite of that, I've been able to, with the help of support of people and God and all these different aspects, I've been able to make my life enjoyable. And my children, when I come home, they have an enjoyable life. They come running out to meet me. My wife is, we all can have a good life, and it's a good life. And if we make the best of it, I have to keep telling myself that every day.
Right. Continuous, like it's a continuous struggle.
It is. It's continuous, yeah.
Right. For
but
everybody.
It is possible, yeah.
Mm-hmm.
Yeah.
And yeah, I think that wraps up our little podcast here. Is there anything else that you would want to share with the audience? Anything that you wish I would have asked you, but I didn't?
I think that's everything.
I think that's everything. Okay. Thank you very much, Greg. And if you guys are watching this at home, thank you so much for tuning in.